All right, we're going to go ahead and get started. Good evening, Riviera Beach. This is Marcia Noel, assistant to the city manager, also serving as your moderator for tonight's call. First, we want to thank everybody for joining us at our regular community teleconference that is now taking place on a bi-weekly basis. On these calls, we talk about everything COVID-19 and city operations, and really anything that you need to know. Before we get into it, I encourage you to please invite your friends, family, and neighbors to join this call. And then in addition, if you are watching online, to please share this recording with others. All recordings of this call are stored online on our YouTube channel, Riviera Beach FL TV. Tonight, you'll hear from members of our Emergency Operations Center, and then we will open it up for any questions that anyone that is on this call may have. So with that being said, we're going to go ahead and get started with initial remarks from our city manager, Jonathan Evans.
Good evening, Riviera Beach. Thank you, Ms. Noel. And certainly, we have seen the numbers as it relates to COVID-19 infections throughout the state of Florida and throughout the nation in certain areas decrease exponentially. And that was the reason why you saw us move into phase 2 on Tuesday, September 8th. The Board of County Commissioners moved Palm Beach County into phase 2, but phase 2 with conditions, and their incremental steps that will be a part of phase 2. Other counties that have moved into phase 2 have moved completely into phase 2. And if you look at the documents that are available on the county's website, you'll see that ours is with conditions, and it's going to take a little bit longer for us to move into certain parts of phase 2 because, remember, Palm Beach County, Broward, and Miami-Dade were the epicenter of those infected by COVID-19. We know that on Monday, September 21st, 2020, that school-age children will be returning back to school as it relates to brick and mortar facilities. And so we have decided to begin to restore city operations Monday, September 21st, 2020. Certain operations will continue on a modified schedule, but for all intent and purpose, things will start to resume, and there will be things that will not come back online because there is still a concern or a high probability of interaction with members of the public, and or we do not have the facilities to accommodate social distancing as provided by the CDC. And that's been the guiding principles that we've utilized as we look to establish policies and procedures. Our city facilities, such as the police station, fire station, substation, and utility district treatment facilities and administrative offices, are deemed facilities of critical significance and will not be accessible to the public, and they will only be accessible to employees that are regularly scheduled to be in those facilities at those particular times. That's to ensure that we do have the depth in the event that we have a unit or a group of individuals that's sick, we can continue to provide service to the residents of our community. So I'm going to go into a couple of procedural protocols that we're putting in place to ensure that our employees are safe as they return to work, and then share a little bit about some of the things that we're doing in the facilities in the city and what you can anticipate. For our personnel, they will be required to wear face coverings while conducting business and moving throughout our facilities. Individuals that enter any city or CRA facilities will have to submit to a temperature check and screening questions. We are asking for individuals to refrain from any physical contact, hugs, handshakes, etc. Individuals are definitely encouraged to wash their hands with soap and water for at least 20 seconds after touching any surface. Kitchen appliances that are used are to be disinfected after each use, and the kitchen disinfectant products need to be properly stored and easily accessible for employees in any of our common areas. Employees are strongly encouraged to possess their own hand sanitation equipment and products, and we have provided them with some, and we have a stockpile in the event that some individuals do not have it. If an individual is feeling sick or ill, they are to contact their immediate supervisor immediately and refrain from coming into work. And if they're exhibiting any symptoms that are communicated on the CDC's website, and we provided them with the CDC's website and the symptoms associated with COVID-19, communal protocols, we're telling folks not to utilize or share cell phones, office phones, computing devices. All that is off limits, and they're supposed to be for singular use only. Face coverings are required in every setting where at least 10 feet, and we push it back to 6 feet, at least 10 feet of social distancing cannot be maintained. Groups of 7 or more people are not permitted to congregate in break rooms and are as mandated by the Center for Disease Control and under the advisement of Riviera Beach Fire Rescue. Employees are actually encouraged to dine alone in break rooms or preferably in outside areas. We're going to make sure that 10 feet of separation is provided between individuals that may be working in a common work area. We've put up some additional barriers, physical barriers, to help accommodate that space, as well as making sure that if they are in a public safety function or operation, that risk management administration are all aware and are providing the appropriate PPE to make sure the employees are safe, because we want to make sure that there's no chance of contamination, and individuals may be required to wear their facial covers for the entire day or their entire shift, depending on if the 10 feet separation cannot be provided. But we have done a lot of work throughout certain facilities to be able to accommodate creating at least those physical barriers, such as sneeze guards and the like, to protect our employees. We're encouraging employees to remain in their assigned work area, not to have them visiting others. And then if they are ill, again, for them to stay home. There's no need for someone to come to the office if they're not feeling ill. We're getting ready to be in the flu season, and the symptoms that you see in the flu and the symptoms that you see in COVID-19 mirror one another. So we're definitely encouraging individuals to be mindful of that. And we're going to have sanitation stations throughout facilities. We will have our restroom facilities sanitized and sterilized every 30 minutes, and there will be a cleaning log to ensure that that continues to occur throughout the time that we are in phase 2 at minimum. Additionally, when we talk about the use of public facilities, phase 2 does provide for some additional restrictions, and we've looked at what are ways that we can reconstitute some of our programs, but doing so in a safe fashion. So with the approval of city administration and the input of legal and risk management, leisure services activities such as recreational and library activities can recommence. However, occupancy numbers cannot exceed 25% of facility or room capacity, and virtual and digital programs are recommended and preferred. So we are going to allow for access to the facilities, but with specific restrictions. Each department that is looking to provide any type of service to the public has to provide a reopening plan that has to be approved by city administration, legal, and risk management to ensure that they can safely open the facilities. Individuals that utilize those facilities are going to have to execute waivers and understand that there will be training provided and expectations articulated as to how they are to utilize the facility. At this time, all organized sports and recreational activities will not resume. However, passive recreation will be permitted. We are not encouraging or allowing for individuals to congregate in groups larger than 7 people. City council meetings and community redevelopment agency meetings will resume in October, and the location will be at the Marina Event Center. And we have put in a new testing facility to be able to facilitate testing for our employees a lot quicker than our previous arrangement. So we have a better model in place to get our employees tested and in essence treated if they need to be treated, or ultimately return back to work with that negative test result. And so those are some of the things that the city of Riviera Beach is doing as it relates to its employees and is looking at its public facilities and communal facilities and doing everything in our power to make sure folks remain safe. Again, remember we have young people that will be traversing our community this week coming up, and we just need to be mindful when we leave our homes to just take that extra look, stop at all signalized intersections, stoplights, and just be mindful that we have some young folks that will be going to school. And, honk at them, wave at them, give them a thumbs up. Any little bit of encouragement that we can give to our young people as well as our educators, I think goes a long way. And we will be out there as far as the Riviera Beach Police Department, and we will be issuing citations, 0 tolerance as it relates to school zones. So consider yourself warned, and please make sure that you drive and traverse our community safely. At this time, that concludes my report as it relates to what the city is doing as we move into phase 2. And I turn the communication back over to you, Ms. Noel.
Thank you, Mr. Evans. Next, we're going to get a situational report here from our current operations chief, Chief Curd.
Thank you, Ms. Noel, and good evening. One of the things I always like to do is start off with the numbers, and I'll get right into it. Currently, the state of Florida has seen a total of 677,660 COVID-related cases, and unfortunately, we've seen a cumulative number of deaths in the state of Florida rise to 13,387. In Palm Beach County, there have been over 44,906 total cases, with 1,272 deaths. Some of the information that we're monitoring as it relates to COVID, and as Mr. Evans alluded to, there is a significant downward trend in our area. And this is attributed to the efforts that have been put forth by you all in the community. But we like to keep an eye on the positivity rates. There is daily and weekly positivity rates that we like to keep an eye on. Currently, the state of Florida's daily positivity rate, meaning that the positivity rate as of yesterday was 4.17, and for the week it was 5.19. These are down significantly from the 17, 18, 20% numbers we saw during the height of the COVID pandemic. In Palm Beach County, yesterday's positivity rate was 3.77%. And the last week's rate was 4.01%. So we are actually doing better on average than the state as a whole. This is what has led us into step 1 of phase 2's reopening. It's the continued downward trend of all of the metrics: emergency room visits, emergency room admissions, hospital bed usage, ICU bed usage, and death rates. There has been a spike, though, in the age group of 15 to 25, based on the contact tracing that has been done by Palm Beach County's Health Department. The majority of that can be attributed to college-age students who have been returning back to their universities. So there is going to be an expectation of increased numbers as our children return to school. But I believe that Palm Beach County School Board has put a robust plan in place to make sure that our children are protected and bringing those children back incrementally, with Palm Beach County Health Department monitoring the contact tracing. The census tract data is another metric that we use to look a little bit more specifically to certain areas within our community and what the numbers are doing within certain segments of our community. And the census tract data has actually trended downward over the last 2 weeks. So I'm happy to announce that we are on the right track, but we need to make sure that we continue to comply with the mandates of social distancing. And actually the term that's being used now is physical distancing. We want to make sure that we're adhering to the mask requirements and making sure we're using the hand sanitizers and washing our hands frequently. The city of Riviera Beach is exploring the possibility of becoming a closed point of distribution, a pod site, for the potential to distribute vaccine within our community when a vaccine does become available. It is unknown at this time when a vaccine will be released. There's been some conflicting information coming out of the CDC and the White House, but based on what I see within the emergency management community, there are plans in place, and we're starting to see the ramp up for what distribution of a vaccine would look like in our area. So that is promising news. We have seen, we have seen us move into step one of phase two. As Mr. Evans alluded to, there's going to be an incremental step-by-step movement into phase two. We are not in full phase two. I know this has created some confusion for individuals within our community, but we are in step one of what is phase two. And what does that mean? Basically, they've lifted in some of the restrictions and limitations on venues such as bowling alleys, escape rooms. They are now allowing movie theaters to operate at a 50% capacity, playhouses at 33%, skating centers, trampoline centers are now open with certain restrictions. Other indoor entertainment venues are also open. Now, what's important to our community is restaurants, food, and establishments. All of the phone calls that I've been getting are individuals within our community wanting to know what is happening with the restaurants and food establishments. And what we've been told by Palm Beach County is restaurants can continue to operate at a 50% capacity indoor. Full capacity outdoor seating is permissible with appropriate physical distancing. Bar top meal service is permissible with appropriate physical distancing. And restaurant and food establishments may operate 50% of their existing billiard tables or gaming tables that they have. So we are starting to see this incremental growth, but again, because it's step by step, everybody wants to be cautious to ensure that there isn't a spike in which we'll have to regress. So please be patient, continue to do what it is that you've been doing. Since these businesses are opening back up, there have been a lot of concerns expressed to city administration and my office, as well as the police department, as it relates to establishments that are violating or that may be violating some of these requirements that have been set forth. Palm Beach County has established a COVID-19 call center to report any establishments that you feel may be non-compliant. What that will do is that will trigger an inspection by a COVID education compliance team, and they will come out, they will validate the complaint, they will have a conversation with the establishment and hopefully rectify any issues that could pose a health threat to our community. If you have a pen and a paper handy, I'm going to give you some options in the event that you want to call in a complaint. The number you can call is area code 561-24-COVID. Again, that's 561-24-COVID. You can also email COVID-19@floridahealth.gov. That's COVID-19@FLHEALTH.gov. Or you can email covidcompliance@pbcgov.org. You can also go to Palm Beach County's website on their COVID page, discover pbcgov.org, and you can also fill out an online form should you not want to use one of these methods. We will make sure that this information gets up on our website so that if you need to refer back to it, you will be able to do so. Moving on to the tropics and what's happening out in the Atlantic. We have seen Hurricane Sally now dissipate and move off. We have 3 other name systems right now that we're keeping an eye on. We have Beta, Teddy, and Wilfred. I can tell you with certainty you will have an uneventful weekend. There are a couple of other disturbances that we are keeping an eye on, but we should have no systems impacting our area over the weekend and into early next week. We will continue to monitor this as the tropics are very active at this time right now with 6 systems moving around out there. So please don't let your guard down. Please don't be lulled into a false sense of security. Now that we've gone through what is referenced as the peak of hurricane season, which was on the 10th, 60% of the storms that impact our area come after the peak of hurricane season. So we are in no way, shape, or form out of the woods yet as it relates to hurricane season, but we can rest assured we will have a beautiful weekend. With that, I turn it back over to you, Ms. Noel.
Thank you. All right, next we're going to hear from our Leisure Services Beach Group Leader, Ms. Frank. Ms. Frank,
yes,
still with us?
Yes, thank you, Ms. Noel. I apologize. Good evening, Riviera Beach. Lady Franks, Assistant Director for Parks and Rec, serving as your Leisure Service Group Leader. Our City of Riviera Beach Municipal Beach is open daily from 9 a.m. to 5 p.m. We have our ocean rescue lifeguards and our police personnel on site daily as well. Our beach capacity on our beachfront is 1,800 patrons. Our Parks and Recreation Beach team monitors daily for your safety. And staff is on site to enforce and remind all visitors and all beachgoers of our CDC guidelines as it relates to COVID-19. Please remember to wear your mask, wash your hands, and social distance. Our beach restrooms facilities are available and will be cleaned and sanitized throughout the day. There's also on-site parking. Also, our beachfront parking along Ocean Avenue has also reopened, so there's additional parking. And that, Ms. Noel, is my update. Thank you.
Thank you. Next, we're going to hear from our Finance Section Chief, Mr. Sherman.
Yes, good evening, everyone. This is Randy Sherman, City Finance Director. Real brief report tonight. I do want to say that I checked out the county website again today for community services. Their CARES Act rental and utility assistance program is still temporarily closed. I will point out, though, that they have an online webinar next Thursday if anyone is interested, and they have noticed that they will reopen for additional applications once they get caught up and due to availability of funds. I do want to add, too, we continue to work with FEMA. We continue to, document and report. The reimbursement process is a lengthy process that goes back and forth a number of times and can take a couple of years before we see any reimbursement. I will say, too, that September is our month for our business tax receipts expire at the end of the month. So we are fully staffed, ready to answer any calls that you may have on that. And again, as far as the utility bills go, as you know, we've been under normal operation since the 1st of August. And again, staff is ready to assist. So Ms. Noel, I turn it back over to you.
Thank you, Mr. Sherman. Lastly, we're going to hear from our Planning Section Chief, Mr. Bailey.
Yes, thank you very much, Ms. Noel. This is Terrence Bailey, your Public Works Director and acting as Planning Section Chief. As you've heard, there are a lot of activities coming up in the next few weeks. The planning staff is working with the ICS command staff as we prepare for school opening on Monday, a significant portion of the city's workforce returning to their duty station on the same day, and the city's transition to open public access to City Hall beginning Monday, September 28th. In addition, staff is building out the model for City Council meetings to safely return to in-person meetings in October, as described by Mr. Evans. We are looking at cleaning and safety protocols for all of our guests so that we can continue to provide an excellent level of service while maintaining the utmost safety for our residents. I return it to you, Mr. Well, as that is your planning report.
Thank you, Mr. Bailey. That now completes our staff reports this evening. Now we're going to enter into any questions that members of the community may have. So if you have called into this line and you'd like to ask a question, you can simply dial *9 so that I can unmute your line. And I'll go ahead and give it a few seconds. All right, seeing that there are no questions before we end, there are just a few more items I'd like to share as announcements for you. The first one is our 2020 census, and I don't know if I can say this enough, but the 2020 census is very important for the country as a whole, but in particular our community. So what I would like to share with you is really great news. So as one of our large or major efforts to encourage our community to take the census, we have a census parade. Yes, a census parade is coming up September 26th. It will take place around 3 locations. And the first is going to be Sadie McCray Park at 9:30 a.m., Monroe Heights Park at 10:30 a.m., and then finally the area around Wells Recreation Center at 11:30. It's going to be a fun and great event. We'll have our police officers, our firefighters, and so many other individuals like our elected officials and what have you, really cheering our community on to take the census. We'll also make sure to have census takers at each of these parks with goodies and things for you to take back home with you. And so we encourage you to come out, step outside of your home, make sure to be present to watch the parade. We're really making an effort to get the word out there and get you to complete your census. But you don't have to also wait for the parade. You can complete your census now by going online at 2020census.gov, or you can call and complete it by phone at 844-330-2020. Again, that's 844-330-2020. Our next community teleconference will take place Thursday, October 1st at 6:30 p.m., and our city council will be present. With that, that completes my announcements, and we ask that you please have a safe and great night. See you later. Bye.